Quick disclaimer before you listen. The World's Okayest Medic Podcast is an educational and commentary platform produced and recorded by me. What we say on here is not endorsed by any of our employers, and we are not speaking on behalf of our employers. Our commentary is our own. Finally, remember to follow your local protocols. All right, May listener questions, take 3. This is the third time we've had to start over. So I got to go to work. I got to get ready in 1 hour. So let's get to it. Get to the first question. Please, Ashley, and welcome to the show.
Well, thank you.
Welcome back.
Thank you. All right. The main hospital in my city is closed. The next closest trauma, cardiac, or stroke center is 30 to 40 minutes away. Should we be flying these patients from this urban area to these specialty centers? Don't we want to keep EMS units available and not have them tied up on long transports? And plus, it will get the patient to definitive care all that sooner.
This is an extraordinarily loaded question. I think this is going to sound like a cop-out non-answer, but it depends on each and every scenario and situation. Yes, there are some times that in an urban area, you may want to fly the patient. If heavy traffic is a consideration, that could make what would be a 30-minute transport turn into an hour and a half sometimes, even if you're going lights and sirens. We used to do interfacility transports by helicopter from Wilmington Hospital to Christiana Hospital, which in the middle of the night is like a 7-minute drive. And I believe 9.1 statute miles in distance, if I remember that from EMS charts, auto populating that in our report. However, when Joe Biden would be in town Friday during rush hour, it would be gridlocked. The police would have everything shut down, and that 9.1 miles would turn into over an hour transport. So yeah, sometimes the use of a helicopter is going to be warranted. That being said, yes, the golden hour is a factor. Yes, time is muscle, time is brain. But frankly, I have seen we're 30 to 40 minutes away used as an excuse to fly softball patients. If I may be honest, it tends to be the same faces I see utilizing the helicopter for these. Well, we're 45 minutes from the hospital, so we ought to just fly them. I do sometimes see it used as a convenience tool. And again, being totally honest here, it tends to be within 2 hours of shift change that you see a lot of these flights done. So I can see it being abused, but I also can see situations where it would certainly be valid to fly those patients. Distance isn't everything. I think if you looked even at the critical patients that we transport, how many of those patients are getting a time-sensitive intervention within 1 hour of the onset of their symptoms? Probably very few. Yes, obviously an acute stroke that's within a window, a STEMI, a serious trauma. I'm not talking about 75-year-old grandpa is on blood thinners, fell and hit his head, but oh my God, he's on thinners. We can't take him to the community hospital, which you can. I will argue that every day, but I digress. Another thing you have to consider is how long is it going to take the helicopter to spool up and get to you? It is not that fast of a process. Most programs are not government funded, therefore they fall under Part 135 of the FAA requirements. We're not the state police. We can't just say, oh yeah, let's fly, turn on the helicopter, lift and go. There is a process. The pilot has to do operational checks, has to go through an operational control center. There needs to be a flight plan, a risk assessment completed. Where I am full-time on the ground, we are 40, 50 minutes from specialty centers in any direction. That being said, we fly out very few patients, maybe 5 a year. And the last couple times I have flown somebody out and I have heard from my counterparts, I have been thinking, where the hell is the helicopter? And I'll look at the flight tracker and I think, oh my God, they haven't even lifted yet. A lot of times when they're giving an ETA, so let's say you're on the ground, you request an ETA of the helicopter, they contact the aviation dispatch center. That aviation dispatch center gives them an estimated time of arrival from the time they lift. Medevac 2 is 7 minutes from you. Well,
But
that
they
doesn't
may have
include
like
them getting the
another
page,
15 minutes of,
walking out to the helicopter, doing a walk around, the pilot doing the risk assessment, filing it with OCC, it getting approved, and then the launch sequence. I make it sound like the Apollo rocket when I say that. But that 7-minute ETA can really, not quickly, but very slowly turn into a 37-minute ETA. So that is something else to think about. Sometimes it's quicker to just freaking drive them to the hospital. The other thing is you must ask, is it really worth the risk of putting this patient on
yeah.
the helicopter? I know we poo-poo this, and I have been guilty of saying that the safety buzzword is sometimes overused. But a helicopter is like any other intervention. I equate it to intubation, to giving a med, to giving a ketamine sedation. There's benefits and there's risks. The risks were evidenced this week. Penstar 1, they didn't crash. They had a hard landing. Kudos to the pilot who
Whoa.
very, very, very skillfully saved a lot of lives, not just in his helicopter, but on the ground
In the house
with
next to.
successfully landing the
Yeah.
helicopter. And I use that name because it was out in the public and it was on the news. Everybody knows about it now. And there's going to be questions about what happened, what led up to it. But I think another valid question to ask is, what were they going to?
Right. Was it something that really needed a helicopter?
Is it worth putting this patient on a helicopter? The other thing to think about is the cost that the patient is going to accept. So, all right, you're 45 minutes from the helicopter. It's 5:30, so it's getting close to shift change. He's 75. He fell down. He hit his head. He is on Eliquis. He has a boo-boo to his head. He is otherwise, OMG, FINE, fine. But the local hospital says, oh no, can't bring him here. He's on thinners. That's a trauma, even though he's going to sit in the hallway bed at the trauma center until next Sunday. So then you go, you know what? I've checked the box. He needs to go to a trauma center. We're 40 minutes away. Let me call a helicopter. That's a bullshit
Does
flight.
not warrant a helicopter.
That is a bullshit flight all day long. And you are also potentially racking up severe financial hardship for that patient.
Yeah, that's a lot of expense, a lot of resources. And again, you're putting, unnecessarily putting at least 4 people at risk of potential accident.
Yep.
So,
And with the cost, yes, I acknowledge they have since changed the law. United States Congress passed the No Surprises Act. So no longer can you get a bill from, I'm not going to use the name of a company, but no longer can you get a bill from an air medical ambulance that says, hey, insurance covered $1,200. You owe us $75,000 and we're putting a lien on your house if you don't pay. That's no longer allowed like it used to be. But still, I tell the story that we flew a kid from an ATV accident and you worked with his mom, so you got the real tea. This kid was fine, absolutely fine. He did end up having a splenic laceration, but he was fine. I put a whopping 18 gauge saline lock in his antecubital fossa. It was a 7-minute flight to the pediatric trauma center. He talked about how cool the helicopter was the whole time, and they got a $67,000 bill.
it's crazy.
So, also, let me talk about this whole keeping EMS units available thing. I have vacillated and I change my mind on this and I go back and forth. When I worked in the urban area, and I really didn't care about the whole system, like the availability of other resources, because if I was tied up with a patient and I was like, you know what, this is like soft ALS, this could go BLS, I would usually just ride it in because F it. It was 10 minutes to the hospital and there were 20 other paramedic units available. And oh my God, we're pulling a unit from 20 blocks away to come cover. Who cares? Now that I work out in the boonies, I'm one of 2 paramedic units that are available for like a 210 square mile area. And you pull me out for 2 hours. That's a consideration. So I think you have to, again, ask yourself the question, am I really, truly depleting the area of a really needed paramedic resource with no other backup or close unit that can come in and cover? Or am I just using that as a bullshit cop out to justify flying a patient so that I don't have to transport them?
Yep. I agree with everything that you've said. It can sometimes be kind of a hard call, but
It is. And I see I've had to make that decision on the ground before, and I see it all the time landing at scenes. I sometimes have some crews that are like, hey, I I thought we should just err on the side of caution. And some of them I'm going looking at them and I know them from having dealt with them before. And I'm like, oh yeah, I bet you were really like having to decide hard what you were gonna do. But some of them it's like, yeah, like you rarely ever use us. Like,
Mhm.
yeah, you're good, dude or dudette. Like, it's all good.
All right.
All right.
Good. All right. What is the ideal path from new paramedic to a leadership position? Degrees, certs, etc.
Knee pads and hurricane spray. Uh
Probably not wrong.
well, how do I best answer this question? I don't really know. I've seen some people get promoted prematurely just because they have good qualifications. Like they have all the letters after their name and their degrees. But then I've seen people get promoted where I'm like, this person is way too young, has not been on the street long enough, and they freaking thrive in a management position.
Mhm.
So this is a hard question for me to answer. Also, I was both a lieutenant and then I was the operations manager of a team. And I think I'm a very good paramedic. I think I'm a decent educator. I am not a good supervisor and I am not a good manager. I'm good like line supervision. I'm not good at like the whole long-term planning and the strategic vision and the
I think you are. I think you're very good at all of those things, but I just think that's not like what you like and what you enjoy. I don't, so you think that you're not good at it because it's not, you're more of like an in the moment and like policies, procedures, protocols, like that kind of.
I do. That is one thing I pride myself on is knowing the policies and procedures better than the
Yeah.
managers. Like I can quit. That's one thing I would tell people, and that'll help answer this question. Know the SOP manual,
Mhm.
know the employee handbook, know your protocols backwards and forwards, sideways, upside down.
It's, the fact that you just brought that up, it kind of surprises me that so many organizations and even providers now don't really know all of their SOPs, bylaws, all of the stuff, protocols. Because even when we were in college and we were on a volunteer college ambulance, like that was one of the things that we had to know like all of those things inside and out to even like get promoted and to move up. And
Different generation.
yeah, it's kind of funny to think that a lot of people don't know those things. Those are super, super important.
Yes. But as far as prepping you for a leadership position, I truly don't know. I really don't know. There's good leadership books. I think the degree thing, I'm not saying there's not value in it. I have 2 master's degrees. One of them is in healthcare administration. I had a 3.9. You've heard this all before if you've listened to the podcast. I have a 3.9 GPA in my master's in healthcare administration from the brick and mortar University of Delaware. Great program. We're not talking about like the bullshit online Eastern Ozark Governor's Regents College of the Redwoods, where you pay and you get your degree. It is a legit master's degree. I excelled at it. I got appointed to the governance committee for the program. And I am not touching myself by telling you this. I am using that to illustrate my point that I graduated from that program knowing fuck all about healthcare administration. I just did it make me well-rounded? Did it help me learn to write better and formulate an argument and research? Certainly. But leadership position, it helped me get a leadership position because I saw that master's degree. But prep me for it? Not really. So I don't know. You've been in a leadership position in nursing. What do you think?
Most places are going to require a degree of some sort, usually, or at least you're going to have a better chance if there are multiple people vying for the position. But I think that clinical work, knowing your protocols and knowing treatments and critical thinking and all of that is really what helps to make the best leader. So I think clinical experience and critical thinking is like one of the most important things to have aside from a degree.
Do you feel that your degree in healthcare administration helped you at all in your management role?
Maybe like the tiniest bit with budgeting and scheduling and stuff like that. There were like just a few things that we learned here and there, but like staffing, but not really. I mean, we did that one big project where you had to, budget and figure out how you were going to allocate your resources. So that was helpful, but it was like one project out of what, a 2.5 year program.
Yeah.
So, I mean, very, very little. And that's all stuff that you actually can learn or be trained to do in your leadership position anyway, that you don't necessarily have to learn in school. So, I mean, I don't think the degree was all that useful. I think being hands-on and knowing your system and knowing your field really helps. That's what's going to get you further.
All right. All right. We're back. We're having some technical difficulty. All right.
All right.
Next question.
Next question. Starting medic school in September. I've heard bad things from current students. How worried should I be?
I guess maybe 50% worried. You're always going to hear complaining from people. I also have to say is consider the source. Some of the best teachers I ever had were ones that I heard terrible things about going into the class. Each program has its benefits and each program has its drawbacks. Like when I went, the clinical experiences were bar none some of the best clinical training I've ever had to date. Like my hospital clinicals, my anesthesiology rotation, things like that. They were amazing. It's where I learned to do skills and learned to do patient assessment. The classroom aspect, our instructor and the gaggle of gremlins that she got to come in and teach us was terrible. And I'd teach myself the entire program. Paramedic school is what you make of it. I always tell people that you have to be ready to teach yourself the entire program. You cannot rest on the instructor to just teach the entire program. The instructor can only do so much. You have to follow it up with self-study. You have to read the textbook. Also, sorry, and I'm not giving excuses for poor paramedic programs because I have certainly called up paramedic school program administrators when I've had a struggling student and have been like, how did this person get this far? Like they're telling me they have straight A's, but they don't know what an alpha receptor is. Yeah, how is that? Can you explain to me how this person has gotten this far? That being said, having a bad instructor or even a bad program is not an excuse to not know the material. I vaguely remember, I could be totally making this up in my head, but I vaguely remember my dad saying that he had a professor in medical school, and I want to say it was histology, that was just absolutely terrible. Well, he still had to pass it. He still had to learn it.
Right.
And he had to teach himself this stuff. The National Registry does not care how good or bad your instructor was. If you fail, it is your fault and not the fault of your instructor.
Mm-hmm.
Yes, some instructors suck. Some are shameful, but it is also upon you to know the material and pass it.
The other thing is you could actually have an instructor who's actually a very good instructor, but they may have a totally different teaching style than your learning style.
Yes.
And so they may be a great instructor for somebody else with their similar teaching/learning style, but you may have to still go above and beyond to like learn the material a different way that it's going to benefit you.
Different instructors click differently with different students. So just keep that in mind. This is a good lesson to do your homework and due diligence when picking a paramedic program or any program to go into. If it has a reputation of a shitty program, don't do it.
Yeah. I was thinking about that when I was reading the question. I was like, well, this person's starting medic school. You've heard bad things from current students. So was that like, did you not know that ahead of time, or were you just like
Now, if it's the
doing it
only,
either way?
and if it's the only game in
yeah,
town,
then
or if it's one of those where it's like, well, I either have to do a 2-year program during the day, or I have kids and I work, so this is a
yeah,
night
you don't have a
program.
choice.
You got to do what you got to do.
Exactly. But yeah, do your homework about the programs too.
But at the end of the day, it's on you, not your instructor.
Yep. All right. In the absence of blood products, how much saline is too much for a hypotensive trauma patient?
Oh, this has been a huge discussion with the whole, because I'm big on the blood, as everybody knows. And very shameful of what Boston and Massachusetts have done with the blood. Very, very shameful. Still drama. I will answer this question, though. I will get back on track. I do feel like Donald Trump, though, when I talk about blood, because you know how he gets fixated on something and like keeps coming back to it.
Circling back to it. You could be talking about something totally different.
Yeah. Mr. Trump, Mr. President, we're commemorating the moon landing. Thank you is a very great thing. Biden left us with the worst border in history. And I'm not talking politics. I'm just doing an impression.
Example.
But this is how I feel like this is how I am with the Massachusetts blood thing. And I need to be better about it. But actually, I don't need to be better about it. Okay. But I keep hearing this thing. You talk about blood products. Yes, we want blood products. Everybody loves blood products except for Beth Israel. And unless it's in a helicopter. But what do you do if you don't have blood products? Shouldn't we be giving saline boluses? And shouldn't we be using pressors? Pressors, no. They're just going to make the patient squeeze their vessels, and they're going to bleed more. Everybody gets on this vasopressin kick because there was one study from the University of Pennsylvania that said vasopressin, I don't think there was a mortality benefit. Don't quote me on that. But the benefit was that less blood products needed to be infused. So patients who got vasopressin, they had less blood product requirement. So everybody started jumping all up and down. Oh my God, we should be giving vasopressin. I think there's an excellent argument for why we should be giving vasopressin. I don't think the data is there yet. This was one study and it was a small population size. So I don't think we can just say, oh, we'll use vasopressin as the pressor. Mm-mm. But the question was about saline. How much saline is too much for a hypotensive trauma patient? Well, I'm just a paramedic here, but I happen to have access to one of the greatest trauma surgeons on planet Earth, who is one of the top dogs in military medicine, spent a couple years in Iraq, got many, many awards, and is one of the grand poobahs of trauma at my amazing trauma center, where I must brag. I have been to many trauma centers before, I think we do trauma better than anyone else. That's just me, at least from what I've seen. So I emailed him this question, and he responded back with, I quote, as little as possible, titrating to a blood pressure of 90 systolic. That being said, this question was asked this month, but this was an old question from a couple of years ago when I emailed him. So I emailed him a couple of years ago. Since then, the Army has changed the damage control resuscitation guidelines. The new minimum systolic blood pressure is 100 systolic because they said we were under resuscitating patients. And if it is a CNS injury, so if you have neuro involvement, it's 110. I don't like to give fluid to my trauma patients. I just don't. It's bad. It's bad all around. The data is clear as the Caribbean waters that giving saline or lactated ringers, they both suck to your trauma patient is bad. But if there is neuro involvement, you need to get some perfusion to that brain. Hypotension is a killer. So I would be more apt to give more saline than I would if there wasn't a neurologic insult.
But that you still would do it in like small doses and
reassess. I wouldn't flood
You're not going to like flood. You're not going to run over your back.
I'm a 250 at a time kind of guy.
Exactly. So a little bit at a time, reassess, and get them to the hospital as quickly as you can, because You've even had multiple trauma surgeons tell you that like they can't stand when patients receive too much fluid ahead of time. It makes it's terrible for them when they go to cut into the patient and it's just an artificial blood
Yeah, one
pressure.
trauma
And
surgeon said it drives me nuts when I slice into the patient and I'm hit in the face with pink Kool-Aid
yeah,
because the patient's been over resuscitated. And you wash out microclots that form, you induce a hyperchloremic acidosis, you are dropping their temperature as you're dropping their pH. Just not good all around.
yeah. All right.
There's also drawbacks to giving lots of blood products. It's not just blood is amazing, blood is life-saving, but blood's like anything else. There's consequences with giving blood. But another topic for another day.
All right. How do you balance all things, work, family, kids, social life, etc.? And how do you find the energy to get workouts in? The rotating days and nights plus kids is rough.
Yeah, this is a good question. Cocaine. No, I joke. I don't have a ton of days off. I am really big on quality over quantity of time off. Actually, I read a book years ago by Simon Sinek. I think it was Leaders Eat Last, and he talked about how they have studied working families, like where mom and dad, or even if it's a single parent family, they have studied where the parents they're working all the time. And they found that it's the quality of the time spent with the family, not the quantity. So I feel like when we're off all together, I feel like we do a lot. Like it is quality time as opposed to just, oh, we're all together. We're sitting around the house doing nothing.
Yeah.
Like certainly, yeah, that does happen, but we always do stuff. Like we go out to dinner, we do pool days, we go to the beach.
Yeah.
So make it count when you are off. As far as working out, force yourself to do it. It does suck. I find 90% of the time when I'm between nights, I don't want to do it. I'm tired. I feel like a slow moving freight train when I get started, but after 5-10 minutes of vigorous exercise, you're going to feel it. It's going to be good. And you're going to take off and you're going to keep going and you're going to have more energy. This is another thing like the leadership question. I don't have a good answer. Just do it. Live to your fullest. My boss, one of the things I have taken with me my entire life, my boss, when I worked at a law firm as a courier when I was in high school, before I went to college, my boss told me, he said, life is all about 100%. He said, you've got to work 100%. He's like, and you got to live 100%. And I've kind of taken that
It's true.
and applied it to my life.
It's true.
Sometimes I go a little, not so much anymore. Sometimes I was living 180, 190%. Doesn't go well. So there's definitely balance, but
Yep. And whoever asked the question, obviously they work rotating days and nights, and have kids. So that's definitely even harder when you flip flop shifts. You don't really have that so much. not so much
working straight
anymore.
nights is the best thing I've ever done.
But that's really hard. And there have been all kinds of studies done on night shift work, but also rotating shifts and how that can be really hard. So you just have to kind of try and do things that relieve your stress on your days off and spend as much, like Mike said, quality time as possible. All right,
Next question.
let's see. Body armor for regular EMS. My thoughts have changed since the Kansas City medic was killed. What about external versus concealed carriers?
Okay, first things first. The Kansas City medic being killed is incredibly tragic. That stabbed by a mental patient that they probably shouldn't have been transporting, not to get all political, shouldn't have been on the fucking street, not in a jail cell, but that's beside the point. I've seen a ton on social media about using this as justification for body armor. A knife is going to go through body armor like it's going to go through that sweater. It's physics. Body armor, Kevlar, is not going to stop a knife attack. It's just not going to happen. They do make body armor that is both bulletproof and knife resistant. It's very expensive. It's heavier. Or You could go really buck wild and wear ceramic plates. That's going to stop both. I am not a ballistics body armor expert, however. So let's just talk about the question as I continue to ramble. I think we probably should be wearing body armor. I really do. I think it is a good idea. That being said, I'm not going to wear body armor unless it's required because I hate it. When I worked at Crozier, it was mandatory. I hated wearing body armor.
It's mandatory when we
It was
worked in Wilmington.
it was not mandatory
But
when
we
we
did
worked
wear
as
it.
EMTs in
mean,
Wilmington
we would have.
because we were young and it was cool. But
And
no, it was probably
and it was
smart.
stupid not to. Wear it.
Yeah, it was mandatory when I worked in Chester, and not to get all war story time because well, let me backtrack. I think we probably should be wearing it, and I think we probably should be wearing it all of the time. I think these policies where you only put it on for hot calls are problematic.
Yeah.
Because it is always the unexpected call that is going to turn into a hot scene. You just don't know what you're going to walk into. I think it's either you wear it all the time or you don't wear it.
Mm-hmm.
So to illustrate the point with the war story I was going to bring up is it was a hot night during the summer, was working at Crozier, and I said, fuck this thing. I said, the supervisor is not going to notice if I'm not wearing it. So I took it off because at the time I was wearing an under the shirt carrier, not an external carrier. And I'm not saying this for storytelling purposes. 10 minutes later, we got dispatched to a simple assault. Came in as a woman struck in the face, standing out front of a residence. Chester PD are en route. They're like, okay, this is going to be a woman with a fat lip from a domestic assault. We'll take her to the hospital. Long story short, ended up, she was murdered. We were there with two cops who had their guns drawn and the actor with a bloody knife in hand on scene. And I am 2 feet from all of this going down and thinking, holy shit, I wish I had my bulletproof vest on right now. So I think we should be wearing it all the time. But until they make it mandatory, I'm not going to be wearing it. Now, somebody also asked, what about external versus concealed carriers? I think the concealed under the shirt body armor is a form of torture
Doesn't bother me.
No, people say, oh, you get used to it after a while. No, I wore that thing for 10 years and I never once got used to it. I never, ever, even on a 30-degree day in the winter, did I go, oh, geez, I don't even notice that this is here. I hated every second of it. If you want people to comply and to wear body armor, you've got to let them wear an external carrier. You just have to.
I agree with that. I mean, the internal under the clothing did not bother me, but also I'm cold all the time and I felt like it gave me better posture. So I don't know. I liked it. But I do agree that I think people would be more compliant with an external because then they can, when they're in the station, take it off and easily put it back on and all that. So
yes. Yeah.
I agree. All right. Let's see. All right. So what do you think about police style uniforms for EMS?
I don't think that we should be looking like the police. I don't think going back to Crozier, and I could talk all I want about Crozier now because the health system doesn't exist anymore. Yes, there are valid scene safety considerations with dressing like the police. I also personally, I think it's dumb to cosplay the police. When we worked at Crozier, our uniform was the exact same as the Chester Police Department. And by exact same, I mean the blue and silver striping on the pants, the shape of the badge, the shirts were the exact same uniform style cut. We were indistinguishable from the Chester Police. I do think that is dumb, and I think that it poses valid scene safety considerations. So one of the things I always say when I listen to the podcast and I overuse the term "that being said," but that being said, I have found that the overwhelming majority of my interactions in Chester which is the hood and very, very crime ridden. Look up the stats. The city is one of the most per capita violent cities in the United States of America. The vast majority of my interactions with the public in Chester were overwhelmingly friendly and positive. Even like the shooting calls, like like they knew we were the paramedics and we were like
There to help.
there to help them. Like, yeah, we dressed exactly like the police, I guess from afar, but these people aren't stupid. They see an ambulance pull up.
Right.
They know we're the paramedics. So yes, we were dressed like the cops, but it's all about how you frame your interaction with the patient.
Mm-hmm.
Yeah, I watched people get into some trouble before. A lot of times it's because they went in with their chest puffed out and they went in with a bad attitude. They were antagonistic to the patient, and their interaction, the way they treated the person, not the uniform, is what caused the scene to go to shit. Yeah, there's always going to be someone who's out of control. There's always going to be a threat of violence. But I don't think we should be dressing like the police, but I don't think that it's as much of something that predisposes us to violence as, frankly, some of these pussies on social media make it seem like. Another thing that I see on social media and that I read is that, well, we want our patients to feel comfortable interacting with us. And if we're dressed like the police, that is going to make them not comfortable interacting with us. And again,
You act like a paramedic and not like a cop.
yes, frame your interaction.
yeah.
I go back to my time in Chester. In Wilmington, when we were EMTs in Wilmington back in the early 2000s, we wore the fake cop uniform as well.
Yep.
Rarely did we ever have any issues with the population in those two very violent cities.
Mm-hmm.
Yeah, very rarely, because we were nice to people. So I think we should be wearing uniforms. I really do. I think that it helps people be professional. I think it helps identify us as somebody that is there when you call 911 and we're there to help. I don't think that we should be looking like RoboCop, but I do think that we should be wearing a first responder type uniform, whether that is we wear a Class B, I would say. I guess that's what you would call it at my ground job. It's like a dress shirt,
Yeah.
but with it doesn't have all the badges and stuff, but it's got patches on it. It's got our names and tape, and it says paramedic and embroidered tape above the pocket. I think we look very professional. I think you can look professional in I think a polo and EMS pants is fine. I was on a call with the fire company the other night, and the EMT was wearing a job shirt and he was wearing like firefighter style uniform cargo shorts. I thought he looked very professional. I do think that a uniform is a necessary thing for us to wear. I also don't think scrubs are like, what do they want us to wear? Scrubs? I don't think that's utilitarian for what we do.
Why not? I just don't like the idea of scrubs pre-hospitally and for first responders.
Do you
but
want
why
to
don't-
crawl
but
through
why
like
don't
a
you-
thorn bush
Oh, I see.
and
Okay, I
crawl
see what you
into a
mean.
vehicle in a
Yeah.
ditch wearing scrubs and
Yeah,
sneakers?
no, everything soaks through scrubs and no, I didn't know what you meant
Yeah.
at first, but that makes more sense.
Yeah, no, but I appreciate a good first responders uniform. You don't want to be one of these volunteer types where you respond to someone's house wearing pajamas, flip-flops, and a Dale Earnhardt t-shirt. Like, you want me to pack some Marlboros I had to smoke to get this shirt?
Oh my God. Yeah, I agree. I definitely, that would like not even be a question in my mind. Like I would never even consider anything but a uniform. Like I can't believe that there are places that actually do still allow you to just go in whatever.
There is a place, I will not say the name, that they issued external carriers to their people, and their admin is very like touchy-feely. We want the population to feel comfortable around us.
Mhm.
So they made the external carriers look as non-police type as they possibly could. They look silly. They look like the toy soldiers from Christmas time. They look like they should be standing in front of FAO Schwartz. It looks absolutely ridiculous.
Well, that's not good.
And also, not to throw kerosene onto a debate, it's also incumbent on the population to act like goddamn humans when they
Well,
call 911 and people show up to help them.
yeah,
Let's not forget that.
that's true. And like you said earlier, like the majority of interactions are going to end up being okay. It's,
Yes.
anyway. So, all right.
And again, just to reiterate, the public is not stupid. They can read. I distinctly remember one guy in Chester. We walked in, we're dressed like the cops. He didn't seem thrilled we were there. And then he looked at us and he read either the badge or the patch. He was like, "Oh, you're the paramedics." I think it was cool.
Yeah.
So, like, don't underestimate the public.
I agree.
Just be nice.
Be nice. Be respectful. All right. Bougie versus true rigid stylet in hyperangulated intubation. Bougie seems wrong. Any tips?
The reason that the bougie seems wrong with when using a hyperangulated blade, the reason it seems wrong is because it is wrong. The geometry does not jive. You use a rigid stylet, and not a rigid stylet in the sense I'm trying not to burp. The rigid stylet that comes in the packaging, the malleable stylet, because that's a little bit rigid. By rigid stylet, I mean like a
an
true
actual,
metal preformed stylet that is specifically
stays in the same
made
position.
for hyperangulated blades. That is the best way to go with a hyperangulated blade. I've seen people use a bougie. I've seen them pass a tube with the bougie using a hyperangulated blade, but I've also seen people miss. And then I've seen people go in with a rigid stylet and they get it. So bougie is wrong.
Now, if I think I know the answer to this, but if you had a choice between bougie and you didn't have a rigid stylet, you would still prefer to try using the bougie, or would it make it harder?
I just wouldn't use a hyperangulated blade.
Oh, okay.
I would just use a standard geometry blade.
Okay. With a bougie.
Yeah.
Okay.
And that's what that's what I do. I do like, though, the hyperangulated blade. I talked about that on a podcast that I used it for the first time, and on a really bad Airway. I probably shouldn't have tried it for the first time on that Airway, but the reason I went for it is that it was staring at me in the intubation wrap, and I went, I haven't tried the X-Blade before. Let me give it the old college try.
And you got the tube?
I thought it was great.
Oh, good.
Minimal manipulation. It was great.
Awesome.
Yeah.
All right. OKC launched a program to have...
Oklahoma City.
Oh, okay. Sorry. Oklahoma City launched a program to have medics and social workers on a truck. Thought?
I mean, this is one of those things that sounds like a good idea at face value. I don't know enough about it. I don't think it's necessarily a bad thing. I don't know how they're rolling it, but on a truck, do you mean an ambulance or is it on a chase car? I think that this is just me talking, and I don't do any community paramedicine or any of this social work stuff. But to me, it seems like it would make more sense to be on a community paramedic unit rather than an ambulance.
Right. Or like, like almost like a chase car or like a different type of unit, because I would think that the social workers would need to like spend more time with the patients. So like, I can't imagine them going out, and if the patient is being transported or if it's a quick turnaround, them being able to do a whole lot right then and there.
Yeah, exactly.
Like, there's a lot of planning that goes into with like social work. So unless they go with the patient to the hospital and stay with them, that's the only thing I could think of.
Yeah, and then I just picture the ambulance being on scene. 75 calls are pending. And it's, no, we're tied up because they're trying to call their brother in Alabama.
Yeah. So, I mean, whoever asked the question, if you have more information about how it actually works, like what they do, that's interesting.
Yeah, I mean, I think it certainly could work. I mean, I truly believe in community paramedicine. I think community paramedicine is the way of the future for care that is equitable, valuable, and not wasteful. I will never be the one to practice it, though. That's something I have no interest in doing.
And that's perfectly fine. And there are a lot of people that do like that. So,
which is fine.
But I'm also interested to see like how often these social workers are actually being utilized. I don't know.
Yeah, well, it's like anything else, any other good idea. You'd have to study outcomes.
Yeah, exactly.
Like they have to have a mission, protocols, goals.
Yeah.
So, yeah, I don't know.
All right. Why are
We'll
so
finish off. I like this question. I almost didn't include it,
okay?
but it gives people the red meat that they crave, and I think it's a good finisher.
All right. Why are so many EMS providers so lazy?
You left out, I cut and pasted their
I'm
question.
being professional.
I
But
will ask it
all
then.
right.
Why are so many EMS providers so goddamn lazy? Why do you think this is, Ashley? Let me pose this to you.
Oh God, I don't know. I mean, I think there's probably a variety of reasons. I think sometimes people get set in their routine. If you're used to having some downtime in between calls and you're not like necessarily running 24/7, or you're not like on your feet for a whole 12-hour shift like maybe nurses are, you get used to having some of that downtime, and then that it almost becomes expected and you can become lazy. That's
100% agree with you. 100% agree. My answer is a two-pronged answer. One, we allow it.
well,
We have weak leaders who allow it. They don't set the standard. They have low expectations, and they use staffing and, well, they're here to fill the hole in the schedule. I should specify here to fill the hole. I sound like an ER nurse.
mhm.
Um, we have leaders with low expectations, and they allow it. As Leif Bavin has said, it's not what you preach, it's what you tolerate. We tolerate too much bad behavior. The other is that it is too damn easy to enter this profession, especially at the EMT level. It is, and this is not me shitting on EMTs. We have two EMTs coming on to the podcast. Clancy and Brooke are going to come on and talk about being an EMT and dealing with shitty medics.
Yep.
So you're getting it, EMTs. Don't worry, it's coming. It is too damn easy to enter the profession. There are phenomenal EMTs, but the fact of the matter is that to become an EMT, it's not that hard. Anybody can do it. I have said that you could use the National Registry EMT exam as a litmus test for like cognitive decline. At the paramedic level, I do think it's better. I think it's like nursing. It's a bell curve. You're going to get some morons who pass and are totally incompetent. You're going to get some who should be neurosurgeons, and why are they paramedics? Just like you have excellent nurses, and then everyone else is somewhere in the middle. I think the paramedic level does a better job at weeding people out, but the EMT level, it's sad. And it is, you come to a time in life where you graduate your GED and you're looking at yourself in the mirror with your nose ring and your like different colored hair, and you're going, hey, do I go work at GameStop or do I become an EMT? That's what the National Registry has set up for being an EMT. And it should not be that way. It absolutely should not be that way. And I'm banging on the table. I think that we need to be more like police and fire departments, professional fire departments, not volunteer fire departments. I think there should be testing to get in. I think there should be physical fitness requirements. Should there be an academy past paramedic school? I don't know, but it's too damn easy. Whether you're EMT or paramedic, you jump through the hoops, you get your certification or your license. Good to go. We'll hire you. EMS is the redheaded stepchild. And Fire Medic Steve, I was talking to him a while back. He said the exact same thing. And I was like, it's almost like we like mentally have channeled each other, because he said something very similar. But I have always said that people enter EMS for one of three reasons. One, you're someone like me who is attracted to the job. I wanted to be a paramedic. It's what I guess you could say it's my calling and my passion, as cheesy as that sounds. It's what I want to do. Two, you can't financially or academically hack medical school. I'm not saying that in a shit talking or a putting down way. I wouldn't get into medical school if I applied, and I can't pay for medical school. So that's not a put down. That's just a fact. Some people want to be doctors. They can't do medical school, so they go into EMS instead of going into nursing. I don't know why anybody would go into nursing other than better pay, but you know, if you're a sadist, or not a sadist, a masochist, have at it. The third reason, and this is the big one, that people enter into EMS is because they want to wear a uniform. They want to go on calls. They want to drive around lights and sirens. They want to be in a position of quote unquote authority, like first responder type, but they are too fat, crazy, unstable, and lazy, stupid to get hired by a professional police department or fire department. They can't pass the written test. They can't pass the physical. So EMS is there as the Statue of Liberty with give me your tired, your poor, your huddled masses yearning to be free. They take the National Registry EMT exam, which is too easy. They pass. And now we have a collection of gremlins.
All right. Well, that's a whole bunch of reasons that you gave right there.
Yeah. Stitch that in a reel.
That was more than my first reason, but I can see all of those different things.
The fitness level, we tolerate bad behavior, and I know I harp on the fitness thing. I was looking at the pictures of EMS Day on the Hill.
Yeah.
It was fucking embarrassing. Embarrassing. I mean, these people, look, I made some screenshots of some of the pictures. Well, first off, why would you post those pictures? Why on earth? Even I'll post a good picture of you and you'll look at me and go, why did you post that picture? It was terrible. Like these people, it's like, do you have a mirror at your house before you went to Capitol Hill in your Admiral's outfit? Like, why would you post those pictures? So the devil on my shoulder was poking me, trying to get me to make memes and repost them. I didn't have the heart to do it.
Good. I'm glad.
But god damn. On that note, I think that's a good finisher.
There you go. You got to get ready for work.
Yeah. All right, everybody. That's May listener questions.
All right.
Thanks, Ashley.
You're welcome.
Bye.
See you later. Bye.